7 years ago, my grandmother passed away, and it was so difficult to us before she passed because she could not really communicate with us the way she used to. She out of a sudden had speech impairment and could not follow up a chat from the beginning to the end. Sometimes you ask her some questions and she will give you answers that had nothing to do with the questions you just asked her. My uncles would just say it's she's getting old, it's old age, it's something that's normal or stuff like that. But for me, it was so difficult to accept it because I knew my grandmother. I was so close to her, and knowing I could no longer communicate with her, bringing a topic and chat with her about it, and she would not like follow up. It was so so sad. And if somebody would have told me that 7 years afterwards, I would like explain what she was suffering from, I would not have accepted because right now I'm doing a master's degree in applied linguistics with specialization on language processing because I aim at being a speech therapist. That brings us in today's video. And first of all, for those of you tuning in for the first time, I am Falon Monga, studying and currently living in Germany. And for those of you who are subscribed to this channel, welcome back. So in today's video, I'll be talking about aphasia and all what you need to know about aphasia. So what's aphasia? Aphasia is a medical condition that affects people's ability to communicate, it at the level of speaking, writing, or reading. And how does aphasia happen? So aphasia is a condition that happens to adults from the age of 18 years, and it's mostly due to a brain damage caused by a stroke, brain tumor, or any neurological condition. So everybody can have aphasia. You know, it's not something that's just for the old people. Even young people as well can have aphasia. And talking about the types of aphasia, we have three types of aphasia. We have the Wernicke's aphasia, the Broca's aphasia, and the global aphasia. So in the Wernicke's aphasia, so speech in these individuals is normally um, fluent. They talk fluently, but comprehension is not good, it's impaired. And a question, for example, but they will answer you talking about something that had nothing to do with the question you asked. And I think that's what my grandmother had, because my grandmother had a heart condition. And when she was talking to us, she would tell us things that happened like 20 years before us or 10 years. Just talking about stuff. She was really talking, like the speech was fluent, but we could not understand her, and she could not actually understand the questions we asked her. So that was for the Wernicke's aphasia. And for Broca's aphasia, speech in these individuals is mostly effortful. So they really can't articulate very well. They look for words for seconds, and they can't really have a grasp of a word they want to voice out to express a feeling at that point in time. And in this Broca's aphasia, if the person had a stroke, um, intelligence remains intact. Just that talking becomes a big problem. They can't really talk. You might think they are stuttering, whereas it's not the case. They're just like looking for words in their head, but they don't seem to have a grasp of the words. So that's it for Broca's aphasia. And for the global aphasia, it's all about having some severe difficulties in talking or in reading or even in writing. So how does aphasia influences someone's life? So just imagine you've lived your life, you've had your memories already in your brain, and out of a sudden you can't really remember, or you can remember but you can't share it with someone, be it good or bad memories. Just imagine how frustrating that can be. So that's how people with aphasia feel. They feel frustrated because they can't really communicate or voice out what they want. And this condition is really not easy for the patients or for these people, and as well for family members. And it doesn't end at just communication. These people with aphasia, at some point can't even read instructions or understand signs. So that's how aphasia can impact their lives, making them feel frustrated and sad. Now, diving into how people with aphasia can get help. When somebody is diagnosed of aphasia, the person has to undergo speech therapy. So that's where speech therapists intervene, you know. And at that point, since we could not understand what my grandmother was suffering from, so people with aphasia normally just need to be followed up by a speech therapist. So what does this speech therapy do to help this individual, in regaining back his or her communication competence? So the speech therapists work with individuals to help compensate their speech therapies with strategies aimed at enhancing their speaking, reading, listening, and even writing skills. So I like to emphasize that empathy and awareness go a long way in helping these people with aphasia feel more loved and understood. Because if you can't understand that somebody has aphasia, you think the person is just a mad person. You won't be patient enough to try to make the person feel comfortable. So to be empathetic and understanding, being patient as well, we create a more inclusive environment for everyone, be it for us or for the people suffering from aphasia. So I'll be ending today's video with this note of empathy and awareness. Thank you for watching this video to the end. Stay safe and see you soon for the next video to come. Bye.